Did you know that every year millions of people around the world die from infections that could have been prevented with proper hand hygiene? It's a shocking fact, but one that highlights just how important World Hand Hygiene Day is. Today, we are going to talk about the history, significance, and importance of this day, and most importantly, how we can all do a part in preventing the spread of diseases through good hand hygiene practices. So, let's dive in and learn how we can make a difference. World Hand Hygiene Day is a global awareness day that is celebrated every year on May 5th. It was established by the World Health Organization in 2009 to promote hand hygiene in healthcare settings and to raise awareness about the importance of hand hygiene in preventing the spread of infections. The significance of this day lies in the fact that proper hand hygiene is one of the most effective ways to prevent the spread of infections and diseases. By practicing good hand hygiene, we can protect ourselves and those around us from illnesses like flu, colds, and COVID 19. The idea of World Hand Hygiene Day originated from the WHO's Clean Care is Safer Care program, which aimed to reduce healthcare associated infections by promoting hand hygiene in healthcare settings. The first World Hand Hygiene Day was celebrated in 2009, and since then, it has become an important global event that is celebrated in over 70 different countries. So today, we continue to celebrate World Hand Hygiene Day to raise awareness about the importance of hand hygiene and to promote good hygiene practices both in healthcare settings and in our daily lives. So, according to World Health Organization, healthcare associated infections affect millions of patients every year, and up to 50% of these infections could be prevented by practicing good hand hygiene. The Center of Disease Control and Prevention estimates that healthcare associated infections are responsible for tens of thousands of deaths every year. Uh, a study published in the Lancet Infection Disease found that hand hygiene interventions can reduce the incidence of healthcare associated infections by up to 40%. Another study published in the American Journal of Infection Control found that hand hygiene compliances rates in hospitals were often less than 50%, indicating that there is still a significant need for improvement in this area. In addition to healthcare associated infections, good hand hygiene is also crucial in preventing the spread of common illnesses like the flu and the common cold. The CDC recommends that people wash their hands frequently with soap and water or use hand sanitizer to reduce their risk of getting sick. So, hand washing. So, I will tell the steps how to wash your hands properly. So, first, wet your hands with clean running water and apply soap. Rub your hands together to lather soap, making sure to cover all surfaces, including the backs of your hand, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Singing happy birthday twice can help you to keep track of the time. Rinse your hands thoroughly with clean running water. Dry your hands with a clean towel or let them air dry. You can also use a hand sanitizer when you don't have access to hand washing. So apply a small amount of hand sanitizer to the palm of one hand, rub your hands together, make sure to cover all surfaces until the hand sanitizer is dry. This should take about 20 seconds. Make sure to use hand sanitizer that contains at least 60% of alcohol. Use hand sanitizer when soap and water are not really available. But note that hand washing is still the preferred method of hand hygiene. It's important to wash your hands or use hand sanitizer before and after preparing food, before eating, after using the bathroom, after blowing your nose, coughing or sneezing, after touching an animal or animal waste, after handling garbage, before and after caring for someone who is sick. And there are some habits which can help to reduce the prevalence of infections, like avoiding touching your face. Touching your face particularly your nose, mouth, and eyes, can transfer bacteria and viruses from your hands to your body. Try to avoid touching your face as much as possible. And if you must touch your face, wash your hands first. You should cover your mouth when coughing or sneezing. So, when you cough or sneeze, droplets from your nose and mouth can spread germs to those around you. Cover your mouth and nose with a tissue or your elbow, not your hands. When you cough or sneeze, stay away from people who are sick. Uh, if you know someone who is sick, try to avoid close contact with them until they are well again. This can help reduce your risks of getting sick and spreading germs to others. Clean and disinfect frequently touched objects like surfaces like doorknobs, phones, and keyboards can harbor germs and viruses. Regularly clean and disinfect these surfaces to reduce the spread of infection. And practice good respiratory hygiene. Good respiratory hygiene includes measures like covering your mouth and nose when coughing or sneezing, disposing of used tissues properly, and washing your hands regularly. By practicing good respiratory hygiene, you can help reduce the spread of germs and viruses. Hand hygiene is the single most effective way to prevent the spread of infection in healthcare settings. This is because healthcare workers come into contact with many different types of bacteria and viruses on a daily basis, which can easily be spread to patients if proper hand hygiene practices are not followed. Proper hand hygiene can prevent the spread of healthcare associated infections, also known as HAIs. So, which are infections that occur as a result of receiving healthcare treatment? HAIs can be very serious and can even lead to death in some cases. Hand hygiene is important not only for healthcare workers but also for patients and visitors. And by washing their hands frequently, using hand sanitizer when necessary, patients and visitors can help reduce the risk of infections for themselves and others in the healthcare settings. Good hand hygiene practices include washing hands with soap and water for at least 20 seconds, using hand sanitizer when soap and water are not readily available, and avoiding touching your face and other people if you haven't washed your hands. It's important for healthcare workers to follow proper hand hygiene practices at all times, but especially before and after caring for a patient, before and after eating, and after using the bathroom. Hand hygiene is a key component of infection prevention and control programs in healthcare settings. By following proper hand hygiene practices, healthcare workers can help protect themselves, their patients, and wider community from the spread of disease. So in conclusion, we hope this video has helped you understand the importance of hand hygiene in preventing the spread of diseases. We have covered a brief history of World Hand Hygiene Day, discussed the significance of hand hygiene, shared statistics on importance of hand hygiene, demonstrated proper hand washing and hand sanitizing techniques, and highlighted the role of healthcare workers in promoting hand hygiene. We have also encouraged you to take action by practicing good hand hygiene yourself. Sharing this video with others and promoting the importance of hand hygiene in your community. By working together, we can all help prevent the spread of infections and keep ourselves and our communities healthy. Remember, good hand hygiene practices are simple but powerful. By washing your hands frequently, using hand sanitizer when soap and water are not readily available, avoiding touching your face, and promoting hand hygiene to others can help prevent the spread of infections and protect yourself and those around you. Thank you for watching, and let's all take action today to promote hand hygiene and keep ourselves and our communities healthy.